Hello, my name is Maria Cristina and have been a registered nurse in the neonatal intensive care unit for the past 16 years. During this video presentation, I will be discussing the following topics. Reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. Identify ways poor collaboration can result in inefficient management of human and financial resources, supported by evidence from the literature. Identify best practice leadership strategies from the literature that would improve an interdisciplinary team's ability to achieve its goals. Identify best practice interdisciplinary collaboration strategies to help a team to achieve its goals and work together more effectively. Floating from one department to another in a hospital as a registered nurse is not uncommon, but can be very challenging in your core healthcare experience is different from the department that you are temporarily assigned. After 6 months of training in my department, an RN is eligible to be oriented into a different department, such as the postpartum department or the pediatrics department. With standard hospital policy, you are allowed up to 5 days of orientation and training to be comfortable with the float unit activities. The lead senior nurse in their department would be the first to float. Couplet care in postpartum is taking care of 4 moms and 4 babies. In postpartum, you can take care of 8 patients as a float nurse, which can be overwhelming since my primary care experience is in the NICU. As a NICU nurse, I primarily take care of babies and typically more acute conditions based on my years of experience. While in the pediatrics department, a float nurse can have to take 4 patients in their assignment. Even before I started working at my current hospital, nurses were already floating to the units of their choice. After 6 months probation, my nurse manager told me that I might need to float to postpartum based on operational needs. In preparation, I started my 5-day orientation with a senior nurse in that department. After my orientation, I was allowed to start taking float assignment during my shifts. A few months later, I was asked to float because the postpartum department was short-staffed, and I was the lead senior on my shift. I was terrified since my orientation was over a few months ago. In an article from Journal for Nurses in Professional Development, the charge nurse and the preceptors were very careful and extremely concerned with new graduates floating to other units. Even after months of training, they receive a just-in-time orientation to the clinic or unit by the charge nurse or senior nurse. Even with my years of experience in nursing, I would feel like a new grad because my experience focused on premature babies and not adults when I float to postpartum. For my assignment, I had a full load with 8 patients, and some of them are being discharged in good conditions. Discharging a patient can be very tedious and complicated to explain the care and medication before they leave the hospital, and it takes time. The shift was a blur, and I also helped with the admissions of new patients after discharging one of my patients. At the end of my shift, I felt that I missed some tasks with my patients, and that is not a good feeling because I want to provide the best healthcare regardless of the unit. After 4 shifts later, I was asked to float again to postpartum, and the patients were different. The unit was extremely busy, and asking for help from the regular staff nurse was very difficult. I needed more training or someone to reference when I had questions. During one of my shifts, I found out there was a new floating program being sponsored by a joint committee between NICU and postpartum department. I volunteered to join the committee and help establish goals for the program. The objective of the program was to have NICU RNs take care of babies and postpartum RNs to attend to the mothers when NICU RNs are floating to the postpartum unit. This new program is trying to address patient safety in terms of floating by a NICU nurse in the postpartum unit. Health systems are challenged globally to constantly adapt to the rising number of patients, and nurse managers have been defined as change agents or change coaches of the adaptation process. On the first day of the pilot program, the charge nurse created a specific assignment based on the criteria that were established. The patients were also informed of the new pilot program. After getting a report from the previous shift, My postpartum counterpart and I began our assessments. We identified which patients required immediate attention and started our morning rounds. In the middle of our shift, the postpartum RN was getting behind in her task, and I had to help her with medication rounds and charting. This was not part of the pilot plan, but I also wanted to make sure we do not get behind from our work. At the end of the shift, we had a huddle with our managers to review how the shift went. We were able to pinpoint areas that need improvement for the pilot program. The NICU and postpartum RNs needed to collaborate and increase clarity through communication. However, implementing the change and tracking the improvement was extremely challenging. The nursing managers needed to empower both of us to adapt, but the directives were more implemented from a position of power. From the empirical, pragmatic adequacy of grounded theory, advancing nurse empowerment theory for nurses practice states that through empowerment, each manager would share their power and enable everyone to take personal initiative to achieve the common goals. The charge nurse tried the pilot program on another unit, but the results were the same. The biggest challenge was getting individuals to follow the pilot program and accepting the change that will bring. Not all RNs were willing to adapt the new float program. My recommendations for managers to work with their staff and ask for their input to develop the program. This enforces the concepts from the Villa Health activity that change can be adopted through collaboration and empowers each staff to common goals.